And can I thank the Chair for his introduction and quite detailed explanation of the report. Doesn't leave us much to say. I can also thank the clerking team and the witnesses who came before the committee. Deputy Clerwydd, we regularly discuss in this chamber the way in which Wales addresses mental health provision. In fact, we just had a debate which highlighted very much upon mental health and how we tackle that, the prevention of suicide. We often reflect upon the ability to deliver crisis care and treatment planning, sometimes linked to physical health care and sometimes linked as well to mental health care. Just look back at the debates of the past few years, both on the Health and Social Care Committee's reports and on the Children and Young People's Committee's reports. They produced several reports around mental health in particular. Now, we all know the figures, and it's often quoted, 1 in 4 will suffer mental health, and it's hugely frustrating that it still exists in society, which remains a stigma about mental health, and that undoubtedly stops people from speaking out and getting the support they need, though I am pleased to see action being taken to change that, and I very much support all steps being taken to do so. There are many recommendations in the report, and I'm pleased that the majority have been accepted by the Government, or accepted in principle. However, I have concerns regarding the rejection of recommendation 11. I have had representations from many organisations in my role as Chair of the CPG on mental health around crisis care and treatment planning and the pace at which previous recommendations and actions for their consequent delivery has been undertaken. We all recognise that Mental Health Crisis Care Concordat is an ambitious agreement between Welsh Government and partners to improve the care and support for people experiencing or are at risk of a mental health crisis. Concordat is underpinned by the following 4 core principles and expected outcomes: effective access to support before crisis point, urgent and emergency access to crisis care, quality treatment and care when in crisis, and recovery and staying well. Providing excellent crisis care requires a resolute focus on the person experiencing crisis, recognising them as an individual in need and responding in a person-centred way. The Concordat makes clear that supporting individuals experiencing crisis is a multi-agency responsibility, which requires a joined-up approach, and we must not lose sight of the key issue: the needs of the person experiencing a mental health crisis. The committee heard that since 2015, when the Concordat was introduced, there has been a 90% reduction in the number of individuals detained in police cells who are in mental health crisis, so it can help. Whilst this inquiry looked specifically at the use of Section 136, recommendations, if implemented effectively and with pace, can have a broader impact and support the delivery of transformative change, which was the ambition of the Crisis Care Concordat. The Twilight Sanctuary in Llanelli, the first of its kind in Wales, is an example of partnership working under the Concordat with Dyfed-Powys Police, Carmarthenshire County Council and Hywel Dda Health Board, having commissioned the service working with Mind and Havel. I look forward to seeing the reflection of the good practice in Llanelli being introduced across Wales. I'd also like to discuss recommendation 8, which is based around care and treatment planning. Care and treatment planning is vital to people, irrespective of whether you are suffering with a physical health condition or a mental health condition. However, for those living with mental health illness, the failure to deliver a holistic care and treatment plan can be hugely detrimental, and we could see many getting caught into the revolving door of coming out, going back in, coming out, going back in, and being detained. We are still not seeing enough progress on care and treatment planning. Effective care and treatment plans are a great tool to prevent both crises from occurring, as well as ensuring that people, whether it be those suffering with mental health or their carers and families, know how to access urgent support when they need it. However, there is significant evidence to show that care and treatment plans, in particular crisis plans, are not being used effectively. We are falling short in this area, and as a Welsh Government, it is important we must ensure that this is addressed as a matter of urgency. Now, I've raised this during business questions back in November, and I raise it once more here. We must get the care and treatment plans right, and we must ensure that those people using them have confidence in their care and treatment plans and don't feel that they're merely warm words which do not deliver for them. Deputy Clerwydd, mental health care, whether it be in the community or in police custody, must continue to improve, and we must do more.
Thank you. Mark